here is to help you understand what COPD is, how it affects people, and what can be done to manage it. Now, COPD, it stands for chronic obstructive pulmonary disease. It's not just one illness, but a group of diseases that make it hard to breathe. The two main types are emphysema, which damages the air sacs in the lungs, and chronic bronchitis, which causes long-term inflammation and mucus in the airways. Both conditions block airflow and they make it very difficult for people to get enough oxygen. Now, COPD is much more common than most people realize. In the United States, over 16 million adults have been diagnosed, but experts do believe millions more have it and don't know. Now, globally, there are about 250 million cases, and sadly, COPD is the third leading cause of death worldwide after heart disease and stroke, which shows how important it is to recognize and treat this disease early. The number one cause of COPD is smoking, which in about 9 out of 10 cases are linked to cigarette use. But it's not really just smokers who are at risk. People that breathe in secondhand smoke, air pollution, or workplace dust, and chemicals over many years can also develop COPD. There is also a rare genetic condition called alpha-1 antitrypsin deficiency, if I said it right. That makes some people more likely to get COPD, even if they never smoked. And most people are diagnosed after the age of 40, since the damage builds up slowly over time. Now let's look at what happens inside the lungs. In COPD, the airways become swollen and narrow, making it harder for air to move in and out. And emphysema, the tiny air sacs where oxygen enters the blood are damaged and they lose their stretchiness, so less oxygen gets through, In chronic bronchitis, the airways produce extra mucus, which clogs things up even more. And all of these changes mean the body doesn't get as much oxygen as it needs, especially during activity.
And symptoms. There are many signs and symptoms associated with COPD, but the most prevalent is persistent cough that lasts longer than 3 months. Another common symptom would be increased mucus production and shortness of breath, especially during exercise and other day-to-day activities. Another common symptom is frequent respiratory infections and a wheezing sound that can be heard when breathing. In more severe, prolonged cases, weight loss, blue discoloration under the nail beds, and barrel chest may occur. This is due to chronic inflammation and mucus production that decreases the area of gas exchange, resulting in a lack of oxygen in the blood. Diagnosis. Chronic obstructive pulmonary disease requires a medical diagnosis. A doctor could check the patient's medical history or ask screening questions to identify any risk factors that might be associated with the disease. An example would be asking the client if they have a history of smoking, have any allergies that affect the lungs, or have been exposed to harmful airborne pollutants such as smoke, coal, or asbestos. A physical exam could help indicate other signs such as checking the patient's nail beds for any blue disfiguration. Doctors also use medical equipment such as stethoscopes, for example, to identify any abnormal sounds like wheezing or crackles that could indicate narrowed airways or mucus buildup. A spirometer is another great tool that can be used to measure the air volume in the lungs by having the patient breathe into it. In some cases, a chest x-ray or a CT scan is necessary to identify any lung damage. Lastly, a blood test can be used to rule out any other conditions that could be associated with the lungs. Stages and prognosis. COPD is divided into 4 stages: mild, moderate, severe, and very severe. In the early stages, some patients may only experience shortness of breath, while others may have no symptoms at all. As the disease progresses, symptoms such as prolonged cough become more apparent, and daily activities such as grocery shopping may become more difficult. In severe cases, patients may experience a bluish discoloration under the nail beds, and in severe cases, the chest may even become larger, resembling a barrel shape due to the airways being trapped for so long. Fortunately, like many other conditions, the sooner you seek treatment, the faster you can slow down the progression of the disease before it progresses to the other stages. Treatment. Treating chronic obstructive pulmonary disease involves a combination of lifestyle changes and medical interventions. If you are a smoker, the best thing you can do is to try to quit smoking. That's easier said than done, but there are many interventions out there to help people quit smoking, such as cessation groups, the patch, and more. It's best to consult with your healthcare provider on the best course of action. If you happen to work with asbestos and construction, for example, or coal and mining, you may want to consider finding a different job to avoid these 2 chemicals. Since people with COPD are more prone to respiratory infections, staying up to date on vaccines, such as getting the yearly flu shot, can help. Antibiotics may also be required if the patient has a respiratory bacterial infection. If you struggle with shortness of breath, your doctor may prescribe an inhaler to help open up airways and reduce inflammation, to help ease the hardship of doing day-to-day activities. In severe cases, oxygen therapy or even surgery may be necessary to remove damaged parts of the lung to increase gas exchange. Physical therapy and pulmonary rehabilitation. Physical therapists and pulmonary rehab programs are very beneficial for people with COPD. These programs combine exercise, education, and support to help people stay active so they can breathe better. Therapists also teach specialized breathing techniques like pursed lip breathing, which can help keep the airways open for longer. Another would be diaphragmatic breathing, which uses the belly muscles instead of the chest. Exercise training can help improve strength and stamina as well. And energy-saving techniques are also used to help people complete daily tasks without getting tired. In some cases, patients even learn ways to clear mucus from their lungs safely. Psychosocial impact. As with many other serious health problems, there are also many negative side effects of living with COPD, such as increased anxiety and depression, social isolation, and a reduced quality of life. Many people feel this way because their condition has limited them from engaging in their normal everyday activities, including spending time with friends and family, participating in hobbies, and attending social events. If you or someone you know has COPD, here are a few things you can do to help. Join a social group where you or someone you know can connect with other people who are going through the same thing as they are. This can really help ease the hardships of feeling like you're going in it alone. Seeking emotional help from family and friends helps combat the social isolation associated with having a chronic disease. Lastly, talk to a counselor to help with anxiety and depression associated with COPD. May also be beneficial. In some cases, antidepressants and anti-anxiety pills may also be used as treatment. All right, so now let's hear from someone who lives with it every day. In this video, a real patient talks about their daily struggles and how it has affected them mentally. So, if you or someone you know has COPD, there are many resources out there. The American Lung Association and COPD Foundation offer information, support, and ways to connect with other people with the same condition. Local pulmonary rehab centers in your area can provide hands on help. And lastly, online forums are also a great place to share experiences and advice with other people going through the same thing. Lastly, here are the sources we use for this presentation. Thank you for listening. I hope you have a better understanding of COPD and why it's so important to recognize, treat, and support those living with the disease.